Keith.
Christina.
I'm Atlee.
And BL.
And my name's Harley, and we are part of the PN 1060, Section B, Gerontology of Nursing, the School of Health and Wellness of RDP Polytechnic. Today we are going to be talking about sexual health in regards of the older adult population. Before we get into our sexual health and the topics related to it, we need to understand what is sexual health. But first, we're going to go over the topics.
So here are the topics that we're going to talk about. First, what is sexual health? Social determinants, health aging, key message about sexual health, how can we promote health, and reflection.
To start off, what is sexual health? Sexual health is part of our well-being across all stages of life, including older adulthood. The World of Health Organization, WHO 2021, defines health as a state of physical, emotional, mental, and social well-being in relation to sexuality. This definition highlights that sexual health is about more than just about physical activity, but also includes the emotional and social factors as well. As we begin to grow older, there becomes a gap within our knowledge of sexual health. So today, as a group, we are going to help you fill in that gap. Many factors contribute to sexual health, and one important aspect being social determinants of health. These social determinants of health specifically influence a person's sexual expression. You may ask, what are social determinants of health? Well, according to Ebstrel and House, social determinants of health refer to a specific group, factors both social and economic, that lie within a border of determinants of health, reflecting a person's place in society. These determinants of health include social status, education, and other factors that shape a well-being's behavior. So with that being said, we're going to get into some of the social determinants of health that are related to sexual health. One being social environment. The array values of norms of society that influence and vary ways that health and well-being of the populations. Gibson's page 13. For older adults, sexual activity is almost seen as a deviant behavior, Ebstrel and Hess, page 413, while younger adults, when they engage, it is seen as normal and appropriate, so these social norms may make older adults feel judged and stigmatized, potentially discouraging them from enhancing their sexual health. As a nurse, we need to understand that the social norm for them may be hard to express their knowledge of sexual health within the health environment. So according to CCPNRA, we need to stay within that competency and allow them to express how they feel. Now, gender, the array of society determinants of roles, personality traits, attitudes, behaviors, values, and relative powers influence the society ascribed to two sexes on different bases. For example, transgender individuals often face increased risk of violence, mental health challenges, barriers to healthcare. These influences can also impact the older adults and their ability to maintain a positive sexual health. Disability. It takes many forms and are associated with both acute and chronic conditions and situations. Ebstrel and Hess emphasize the understanding and acknowledging age-related changes can help older adults adapt, maintain a satisfying sexual life, even if their physical and emotional needs change. Lastly, education. It describes the skills and the enable individuals to obtain understanding and the use of information to make decisions. As that intertwines to make up one's knowledge and understanding as information, as some older adults may see sex as less important with age and others don't. Now that we understand the social determinants of health, sexual health is an essential part of well-being, of our overall well-being regardless of age. So now we are going to move into the topic of
How does sexual health challenge healthy aging? Regardless of a person's age, sexual health plays an important role in a person's overall well-being. Engaging in sexual activity can have many health benefits, such as burning calories, muscle strengthening, lowering blood pressure, and it can also contribute to better sleep, and it can reduce the risk of heart disease. 6. In Our Aging Bodies 2024. However, older adults can have their challenges with sexual health. HealthWise Staff 2022 pointed out how menopause can cause physical changes to a woman's body because of the decreased levels of estrogen. Physical changes such as thinning and drying of the vaginal wall can cause irritation during sexual intercourse. Older men can have issues with erections due to decreased testosterone levels, HealthWise Staff 2022. And then, how do STIs challenge healthy aging? Many older adults assume that STIs are more common in younger individuals. However, Ebersol and Hess, page 419 to 420, explains that since older adults have a weaker immune system, they're more likely to get HIV or AIDS. Older adults believing that they are not susceptible to STIs can also contribute to them having a late diagnosis of the disease. It's important for people to do their research on STIs and understand that they can get them at any age.
So, a key message within sexual health. So, I have two types: prevention and education. So, prevention, sexually transmitted infection remain a serious concern for older adults. Using protection such as condoms is one of the most effective methods to prevent the spread of STIs like HIV, chlamydia, and gonorrhea. It is essential to recognize that anyone, regardless of age, can be at risk, particularly if they have multiple partners or are not regularly screened for infection. Taking proactive steps such as using condoms, openly discussing sexual health with partners, and getting regular checkups is crucial for maintaining sexual health and overall well being. As we grow older, some may shift their priorities from genital sex to other forms of expressing sexual desire. Activities that foster affection, romance, intimacy, and companionship may be sufficient to meet the sexual needs of some older adults. However, not all older adults experience a decline in sexual interest. As nurses, it is important to promote sexual health by identifying patients at risk, providing appropriate information, and exploring methods to address their concern effectively. Second, education. So here are the things that they can do. They can talk to a doctor as adult age. Sexual changes are common, but many avoid discussing them with their doctor due to embarrassment. A doctor can help by addressing underlying condition, prescribing medication that don't affect sexual health, and preventing potential health issues. Talk to your partner. Talking about sex can be uncomfortable, but open communication about feelings, concern, and desires is a key to a healthy relationship. Experiment. Changing the routine, exploring new position, and being creative can enhances intimacy and spark fresh ideas for mutual pleasure. Lastly, practice safer sex. Older adults can still get sexually transmitted disease. It's important to get tested with new partners and always use condom to prevent transmission.
And now promoting health. So, as future healthcare providers and as a current practical nurse learner, there are several ways to promote sexual health. According to the National Library of Medicine, they are being sex positive, education, and sex matters. So the first one being sex positive, how can you be sex positive? What does it mean? Being sex positive includes accepting a great diversity of sexual activities, being open minded about how each individual enjoys the kind of sex they're having, and not making them feel like they're being judged. Second is education. Being educated on the topic of sexual health is extremely important for the prevention of STIs and other things that are related to having sex, like pregnancy and building families, etc. Lastly is sex matters. When we ask our future patients about sex, rather than focusing on it as a way to connect and find intimacy, pleasure, or joy, we instead focus on sex as a mechanism for disease acquisition.
Reflection and how it contributes to healthy aging. Sexually transmitted infections can impact many areas of a person's health and well being. Therefore, maintaining good sexual health contributes to healthy aging, as health is a factor in diseases. Sexually transmitted infections have the potential to cause long term problems and damage if not treated accordingly. STIs such as chlamydia are transmitted through vaginal, oral, and anal orifices through the secretions between bodies. Routine STI screening aids in the detection and prevention of STIs, thus maintaining physical and sexual health. Treatment of STIs allows the person to return back to a normal, healthy physical state, which results in aging free of STIs. It is equally important to practice safe sex habits that prevent the spread of infections, such as the use of condoms. As seen through studies, safe sex and sexual arousal are still active parts in the aging population, making education extremely important. Education relating to prevention, where to access screening for STIs, available treatments, sexual health clinics, and more are all ways of providing education to our patients of the importance of sexual health and prevention and treatment of STIs. Prioritizing prevention teachings would be beneficial to ensure disease doesn't spread from person to person, and maintaining good sexual health is important to the overall well-being of the individual, allowing aging without the effects of STIs on the body, as those have a wide range of effects and can be detrimental. Age-related stigmas create the misconception that older adults are no longer engaging in sexual activities, which we know to be false. Therefore, it is imperative to also take into account the older population and the effects of STIs on a person's well-being. With proactive prevention and education, health can be maintained, and if there are STIs that are present, they can be treated accordingly.
Perfect. Now, in conclusion, we thank you for listening to our topic and our presentation, and we believe overall as student nurses that having knowledge of sexual health can contribute to healthy aging, and we would like to thank you for watching, all our group members. Thank you. And here are our citations. Perfect. Okay, guys, good job.